After the age of 60, the body begins to prioritize survival over performance. This means it conserves energy, reduces muscle mass, and limits movement patterns it perceives as risky. Walking, especially outdoors, sends mixed signals to an aging nervous system. Uneven ground, fast pace, traffic noise, and fear of falling all trigger stress responses. Cortisol rises, muscles tense, breathing becomes shallow. Over time, this stress can cancel out many of the benefits people expect from walking. A chair-based exercise routine sends the opposite signal. It tells the nervous system, you are safe. When the brain feels safe, it allows muscles to activate fully. Blood vessels relax, oxygen delivery improves, healing processes turn on. This is why many seniors feel surprisingly energized, not tired after seated exercises. One geriatric neurologist explained it this way. The brain does not care how hard you exercise, it cares how safely you exercise. When safety is perceived, neuroplasticity improves. This means the brain forms new connections more easily, helping with coordination, memory, and reaction time. In simple terms, safe movement helps keep the brain young. There was a case involving a 72-year-old man diagnosed with early-stage Parkinson's disease. Walking had become difficult due to freezing episodes and balance instability. His neurologist introduced a seated leg lift and marching routine combined with rhythmic breathing. After 3 months, his leg control improved, his freezing episodes reduced, and his confidence returned. While the disease didn't disappear, his quality of life improved dramatically without increasing fall risk. This brings us to something rarely discussed: independence. Independence is not lost suddenly. It erodes slowly. First, it becomes harder to get out of a chair. Then stairs feel intimidating. Then grocery trips get shorter. Eventually, people start avoiding movement altogether. Chair exercises reverse this progression at the very first stage, getting stronger in the exact movement that supports independence: standing up, sitting down, lifting the legs, and stabilizing the torso. Walking does not train the sit to stand motion well. Chair exercises do. Every controlled leg lift strengthens the muscles needed to rise from a chair, a bed, or a toilet. This is why occupational therapists prioritize seated strengthening before anything else. Another overlooked benefit is joint nutrition. Joints do not have their own blood supply. They rely on movement to circulate synovial fluid, which delivers nutrients and removes waste. High-impact movement can irritate joints, but gentle repetitive movement like seated leg lifts acts like an oil change for your knees and hips. A rheumatologist treating patients with osteoarthritis once noted that patients who switched from long walks to daily chair routines reported less morning stiffness and needed fewer pain medications. Imaging showed no miraculous cartilage regrowth, but function improved, and function is what matters most in daily life. Let's talk about metabolism, because many seniors struggle with weight gain despite eating less. Muscle tissue is metabolically active. Fat tissue is not. When muscle mass decreases with age, metabolism slows. Walking burns calories, but it does little to preserve muscle unless done briskly and uphill, which many seniors cannot do safely. Chair exercises, however, preserve and even rebuild muscle fibers. Raises resting metabolic rate. Several endocrinologists now recommend seated resistance-style movements for older adults with metabolic syndrome. In one clinical observation, seniors who performed daily chair exercises saw modest but consistent reductions in waist circumference over 6 months without changing diet. Sleep improves as well. Gentle muscle activation during the day helps regulate circadian rhythms. Seniors who move safely and consistently experience deeper sleep and fewer nighttime awakenings. Walking late in the day can sometimes overstimulate the nervous system, while chair exercises earlier in the day promote relaxation later at night. One 70-year-old retired teacher reported that, after starting a morning chair routine, her chronic insomnia improved within weeks. Her physician explained that improved muscle oxygenation and reduced cortisol levels likely played a role. Breathing patterns deserve special attention. Aging often leads to shallow chest breathing. When seated upright with intentional leg movement, the diaphragm is encouraged to move fully. This improves lung capacity and oxygen exchange. For seniors with mild COPD or asthma, this can be transformative. Pulmonologists have observed that seated exercise combined with paced breathing reduces shortness of breath episodes more effectively than walking for some patients. The ability to stop instantly, rest, and control breathing makes all the difference. Now let's address fear, because fear limits more seniors than pain. Fear of falling, fear of pain, fear of embarrassment. Chair exercises remove these barriers. You are stable, you are supported, you are in control. This sense of control rebuilds trust in the body. Trust is essential. Without it, people hesitate. Hesitation leads to stiffness. Stiffness leads to weakness. Weakness leads to dependence. Chair exercises interrupt this cycle early. Caregivers also benefit. When seniors maintain strength and mobility, caregivers experience less physical and emotional strain. This improves relationships, mental health, and overall family dynamics. From a nutritional perspective, combining chair exercises with adequate protein intake, especially leucine-rich sources like eggs, dairy, fish, or legumes, enhances muscle protein synthesis. Nutritionists often recommend consuming protein within an hour of exercise, even seated exercise, to maximize benefits. Hydration matters too. Muscle cramps and fatigue, often blamed on aging, are frequently dehydration-related. Chair exercises increase awareness of the body, prompting better hydration habits. There is also evidence that consistent seated movement improves digestive health. Abdominal muscles activate gently, supporting bowel motility. Many seniors report reduced constipation after adopting a daily chair routine. Even vision and reaction time can benefit indirectly. Improved circulation delivers more oxygen to the brain and eyes. Neurologists note that physical activity, especially safe, stress-free activity, supports sensory processing. Now let's talk about longevity. Long life is not just about adding years, it's about preserving function. Studies consistently show that leg strength is one of the strongest predictors of longevity in older adults. Chair exercises target leg strength directly. A famous longitudinal study observed that seniors who could rise from a chair without using their hands had significantly lower mortality rates. This isn't coincidence. It reflects muscular strength, coordination, and nervous system health, all trained by seated exercises. Walking ability declines naturally with age, but seated strength can be preserved much longer. This means even when walking becomes limited, independence does not have to disappear. Mental health improves too. Depression and anxiety are common in older adults, often linked to loss of autonomy. Exercise releases endorphins, but only if the exercise feels achievable. Chair routines provide achievable success daily. Small wins compound into emotional resilience. There was a case of an 80-year-old widower who became socially withdrawn after a fall. His physical therapist introduced chair exercises at home. As his strength improved, so did his mood. Eventually, he resumed social activities not because he walked more, but because he felt capable again. Let's not ignore the immune system. Moderate, consistent exercise enhances immune response. Overexertion can suppress it. Chair exercises strike the perfect balance, especially for seniors with autoimmune conditions or recovering from illness. Surgeons often prescribe seated exercises before and after operations. Prehabilitation strengthening before surgery reduces complications and speeds recovery. Chair routines are ideal because they do not exhaust or injure patients. After surgery, walking too soon can strain healing tissues. Seated movement maintains circulation without compromising recovery. This is why surgeons approve it. Another major advantage is adaptability. Chair exercises can be modified endlessly. Slower, faster, one leg, both legs, with or without arm movement, with breathing focus, with light weights. Walking has limited adaptability. Weather, environment, and safety do not affect chair routines. No icy sidewalks, no uneven pavement, no crowds, no excuses. Consistency builds habits. Habits build health. Over time, seniors who practice chair exercises often find walking becomes easier, not because walking was the primary goal, but because the foundation was rebuilt first. This is the missing message in senior fitness. Strength before endurance, safety before intensity, consistency before challenge. The chair is not a limitation. It is a tool, and the exercise is not a shortcut. It is a smarter path. If you are over 60, your body is not broken. It is simply asking for a different approach. This one-chair exercise routine respects your joints, protects your heart, strengthens your muscles, sharpens your mind, and restores confidence, all without forcing your body into pain or fear. Walking will always be there when you are ready, but strength, stability, and safety must come first, and sometimes the most powerful step forward is taken while sitting still.